Hello students. Today I am going to discuss about the development of retina. Now dear students, this topic is important to understand the concepts when you are going to learn the optic now. So before starting to read the optic now, you should have the basics about this lecture. So when we will talk about the development of retina, the first and important thing should be there in your mind that this retina is the outgrowth of diencephalon. Now, when you will see the embryology, you have to keep this thing in mind that there is a formation of forebrain. Now, forebrain is giving the part is known as diencephalon, and from the diencephalon, the outpouching is there, and that outpouching is going to form your retina. And the important thing is that your whole CNS arises from the ectoderm, neuroectoderm. So, retina is also ectodermal in origin. Now, when you will see the diencephalon will show the outpouching or evagination in the form of optic vesicle. That means you are able to see that this is the diencephalon, which is the part of forebrain, and it is showing the two outpouching on both the sides. Now, these outpouching on both the sides are known as optic vesicles. Now, in the optic vesicle, there is a invagination. See, there is a evagination, that means outpouching. Then there is a invagination, that means this is a balloon-like structure, and in the balloon, you are pushing your hand to create a deep space or cup-like structure. So there is a invagination. Now, this invaginate transforming this vesicle into a goblet shaped appearance is known as optic cup. So it is a cup shape or the goblet shaped. So what will happen in the next step, that what you are able to understand that this cup is showing this type of the invagination on both the side. Clear? So what is the important thing when you are reading the development of retina, that first there is a formation of outpouching of the diencephalon, then these are known as vesicles. Vesicles will have the invagination. This invagination is going to form optic cup. Now, this cup is attached to the developing forebrain by a narrow stalk is known as optic stalk. So here there are three words are important. First is optic vesicle, that is outpouching. Then there is invagination to form the optic cup, and lastly the optic stalk. Now here you have to understand that this optic stalk is a hollow structure. Initially it is a hollow structure. Clear? Now when you will learn the formation of optic nerve, you will realize that this hollow optic stalk later on filled by the axons of the ganglionic cells. So later on you will see that ganglionic cells will appear and their axons are going to fill this optic stalk to form the optic nerve. But initially this stalk is hollow when you will see the initial embryology. Now what will happen, that this optic cup is now composed of two layers. One is outer layer, one is inner layer. Now here you can see that once there is a invagination will take place, this cup is divided into the two layer. Now inner layer is having the multiple neuronal cells or multi-layered cells, and this is the inner layer, this is outer layer. This outer layer is a single layer, and these single layers are going to form your pigmented epithelium or pigmented layer of retina, and the inner layer is known as nervous layer, and this nervous layer later on differentiate into the different cells of retina. So what is the important thing, that when you are having the pigmented and nervous layer, these two layers are remain separated from each other, and that is known as intraretinal space. Clear? So in this image you all can appreciate this thing, that there is a intraretinal space. Now this space is present between the two layer of optic cup. This is the outer layer and this one is the inner layer of optic cup. Clear? Now, dear students, what is the important thing about the neuronal layer? Because this nervous layer or neuronal layer give rise to the cells. Now, in the retina, you will have the different types of the cells, but they are broadly classified into the neurons and glial cell. Now, when you will see the neurons in the retina, there are 6 types of the neurons which are going to develop from the inner layer of the optic cup. Now, what are the name of these 6 type of the cells? You will have the cords and neurons. So these are the 2 types of photoreceptors. Then one bipolar cells, then ganglionic cells, horizontal cells, and amacrine cells. So in such a way, there are 6 types of the neurons are present into this inner neuronal layer of retina. Apart from that, you have one Muller cell, which is a glial cell present into the retina. So inner cell layer or inner layer of the optic cup give rise to how many type of cells? 7. Out of that, 6 are the neurons and 1 is glial cell. Now, dear students, the important thing is that this developing neuronal layer is now going to seal with the two limiting membrane. It is just like you are making a sandwich. Now, in the middle portion, you are having some filling material like potato or some salad, and you are having 2 slices of your bread. Now, what we are doing here that this developing neuronal retina is now protected or sealed by the outer and inner limiting membrane. So if you will see the limiting membrane, one membrane is there. Now this membrane is, you can see, separating this retina from the pigmented epithelium. Now we are going to draw one more layer. Now this is the inner limiting membrane. Now this inner limiting membrane is separating this developing retina from this vitreous humor. Clear? So sometimes you may have this question that vitreous humor is separated from the retina by which layer? Answer is inner limiting membrane. So external limiting membrane present between the pigmented epithelium and proliferating part of neural retina. So this is your external limiting membrane between the pigmented epithelium and the posterior proliferative area of retina, while the inner surface of retina is limited by inner limiting membrane. Now, dear students, the one concept comes here. Now, when you will see the formation of optic nerve, optic nerve is a basically axons arises from ganglionic cell. Now, suppose you will have the ganglionic cells here. Now, these ganglionic cells will give rise to the fibers of your optic nerve. Clear? Now, these optic nerve fibers will remain deep to this limiting membrane. Please keep this thing in mind that this limiting membrane also separate the ganglionic cell optic nerve fibers from the vitreous humor. Why I am saying this? That some students is having this confusion that the fibers of the ganglionic cell which are going to form optic nerve puncture this limiting membrane and they enters into the vitreous humor. It is not like that. It will never see. What will happen? That the limiting membrane is the area which is separating whatever is present in the retina from the vitreous humor. So whatever the fibers are arising from the different area of the retina in the form of second order neurons, or you can say the your optic nerve fibers, they are remain deep to this internal limiting membrane and they will go and they will converge towards the optic disc. Clear? So this should be clear in your mind. So inner surface of the retina lined by the internal limiting membrane, and it also actually covering the fibers of your ganglionic cell layer which are present on the innermost side of retina, and it is separated by the from the vitreous humor. Clear? Now, there is one more very important structure, and that is central artery of retina. Now, the question should be there in your mind that central artery of retina, how it enters into the optic nerve. Does it going to puncture the optic nerve? Or at the time of development, it is present inside some structure and the structure encloses the optic nerve. So, here, if you will see this diagram, now this diagram is showing very important concept. Now, this is the outpouching. Now, this outpouching I told you is known as initially optic vesicle. Now, in the vesicle, there is a formation of the fissure or invagination to convert this vesicle into the optic cup. Now, dear students, most of us is having this concept in our mind that it is a balloon-like structure and we are pushing like this. It is not like that basically. It is as simple to understand, but basically embryology is not as simple as that. Now, what is happening basically? Now, suppose this is your stalk and this hole is your vesicle. Now, when the fissure will start to form, now it is not invaginate from the tip. It will invaginate from the ventral side, and this fissure, which is going to convert it into a cup, will also continue on the ventral side of the stalk. Now, in this diagram, you can see that this is your invagination and this is continue in the lower part of the stalk also. That means this stalk is also having the lower gap. Now here you can see, if you will cut this stalk, you can see that there are two layers are formed and there is a presence of fissure in the lower part of stalk. Now in the next step, what will happen that you can appreciate in this diagram, there is a hyaloid artery. Now, what is hyaloid artery? Hyaloid artery is the branch of your internal carotid artery, and this from the ophthalmic artery basically. Now, from this hyaloid artery that is coming from ophthalmic artery is running on the ventral side of the stalk. Now, it will invaginate. Now, this artery is now going inside this fissure. Now, this is the fissure. Now, here you can see that this artery enters into the fissure from the lower side. And gradually, along with the artery, there is a vein also. And gradually, what will happen? The two lips of the fissure closes. As the growth is there is a completion of this fissure. And now, the artery and vein is entrapped. And this entrapment of hyaloid artery is later on persist as a central artery of retina. So basically, when you are having this concept that how the artery present into the optic nerve, then the question is about, is it going to puncture the nerve? No, it is not going to puncture the nerve. Basically, there is a hyaloid artery which actually trapped into the fissure present on the ventral side of the stalk, and then later on the fissure is closed, and once there is a closing of the fissure, this is the trapping of artery. Clear? So here the question is how central artery and the vein of retina appears in the optic nerve. So the important thing comes is about hyaloid artery. So there is a hyaloid artery which develops from the branch of ophthalmic artery, and it gains access to the retinal space by the fissure, and that is known as optic fissure on the ventral surface of the stalk. Now this hyaloid artery is basically is giving the blood not only to the developing retina, but also it is going up to the lens. So it is supplying your developing retina and the developing lens vesicle. Clear? But later on, what will happen once the lens is become mature, the need of blood supply is hampered. There is no need of blood supply. So that part of the artery, that means from retina to the lens, which is passes through the vitreous chamber, disappears. So the edges of the fissure fuses and it encloses the hyaloid artery and vein. Now that is known as hyaloid canal. So when you will see the eye, now suppose this is your eye and posteriorly this is your retina. Now suppose we'll draw the lens. Now this is your lens. Clear? Now what is happening initially? Now initially this is your artery and this artery is going up to the lens. Clear? Now this hole is your hyaloid artery. Now this portion is the retina. This is your retina. So what will happen later on, as the need of blood, direct blood supply to the lens is not there when there is a maturation, what will happen? This portion of the hyaloid artery disappear. Clear? This hyaloid artery is passing through this vitreous chamber, and initially there is a canal is present, or a passage is present through this hyaloid artery is approaching, is known as hyaloid canal. But in adults, after birth, in mature babies, this canal is empty, this canal is not having the artery. So hyaloid canal is present in the vitreous chamber, which shows the intraembryonic presence of the hyaloid artery. After the birth, this part is not there, so hyaloid canal is persist, and this proximal part of hyaloid artery inside the optic nerve persists as a central artery of retina and equivalent to the vein, central artery of vein. So when the lens mature, the vessels serving the lens degenerate, and the proximal hyaloid artery and vein persist as a central artery of retina and central artery of vein. Clear? So this should be very clear in your mind. Now this diagram I will explain again, and this diagram is important to understand that once there is a fissure, the fissure is having the hyaloid artery and vein, and later on the both lips of the groove will enclose. So when the fissure will enclose, there is a trapping of the artery and vein. Initially they are known as hyaloid artery, and later on their proximal part, that means in the stalk, persist as a central artery of retina. So now the question, now what type of questions you will have from this lecture? So there are two basic questions which may be asked in your exam. First, what is the basis of retinal detachment? Now, what is the basis of retinal detachment means that whenever a patient comes with the retinal detachment, it is always a detachment between the two layers of optic cup, because you have seen that optic cup is formed by the invagination and there are two layers, and later on both layers will fuse and the intraretinal space disappears. But that is a potential space. That space can be detached if the neural layer separate from the pigmented layer. It is known as retinal detachment. So the inner wall of the optic cup is giving rise to the neural retina, and whereas outer wall give rise to the your pigmented retina. So there is a presence of intraretinal space. Now this intraretinal space which is present here is a potential risk of the detachment. So whenever you have this question in your exam, write down the basis of retinal detachment. You have to write down only in two lines that there is a presence of a space between the two layers of optic cup, which later on going to your origin of neural retina and pigmented epithelium. So that space, if detach, if the both layer will detach, this space become potential space for the detachment. Clear? The important thing which you have to keep in mind, again I am saying that which layer separates the pigmented epithelium from the retina? Answer is external limiting membrane. And which layer separates the retina from the vitreous humor? Answer is internal limiting membrane. But here you have to understand that the fibers of ganglionic cells which are going to form optic nerve also lies below the internal limiting membrane. They don't go into the vitreous chamber. Now we'll move to the next question. The next question is based on the retinopathy of prematurity, ROP. Now when we have the premature babies, if the baby born on 28th, 26th week of intrauterine life, the baby's retina are having the visual impairment. This baby born with the visual impairment, and the reason is ROP, retinopathy of prematurity. Now in this condition, what will happen that this hyaloid artery which is present in the vitreous humor is still there. In case of the mature baby, in case of the full term baby, this hyaloid artery is not present, it disappears, your vitreous humor is not having the higher vascularity. But because this baby born with the very early prematurity, so what will happen, this lens is also not mature completely, and still this vitreous humor is highly vascularized. So this high vascularization of your vitreous humor, lens and retinal epithelium is having the visual impairment, and it is defined as a ROP, retinopathy of prematurity. Clear? So by the end of this session, I am able to explain you about the two basic questions which has been asked so many times in exam: anatomical or embryological basis of retinal detachment, and what is ROP, or why there is a visual impairment in the premature babies. Clear? So I hope you like this video, and thank you and bye bye.